Today we're here to discuss osteoporosis. Osteoporosis is a musculoskeletal condition that is characterized by reduced bone mass, deterioration of bone matrix, and diminished bone architectural strength. Osteoporosis most commonly produces no signs or symptoms. In fact, most people are unaware that they even have osteoporosis until a fracture occurs. If a fracture occurs, the person will likely experience pain at the site of fracture. Other signs that osteoporosis can cause include loss of height, a hunched posture, and a hump located within the upper thoracic vertebra known as a dowager's hump. These specific signs of osteoporosis are caused by a compression fracture of the spinal vertebra. Osteoporosis also commonly causes back pain. The mnemonic axis can help explain some of the risk factors for osteoporosis. These include alcohol use, corticosteroid use, low calcium, low estrogen, smoking, and having a sedentary lifestyle. As well, small-framed women are most at risk for developing osteoporosis, especially postmenopause due to the reduction of estrogen. To prevent osteoporosis, it is important to maintain an adequate daily intake of calcium and vitamin D. It is recommended that a daily intake of 600 to 800 milligrams of calcium and 1,200 international units of vitamin D will aid in the prevention of osteoporosis. Another way to prevent osteoporosis is to engage in daily weight-bearing exercises. Such activities may include walking. As well, to prevent osteoporosis, you should stop smoking and avoid secondhand smoke. Heavy drinking should be avoided, as more than 3 drinks per day increases the risk of developing osteoporosis. Osteoporosis is diagnosed through a variety of different methods. Brittle and thin bone can be detected through a CT scan, X-ray, or MRI. A diagnosis of osteoporosis is confirmed through a DEXA bone mineral density scan. Having a T-score of negative 2.4 or greater on the bone scan positively correlates with the diagnosis of osteoporosis. Safety is a number one priority of the nurse when caring for a patient with osteoporosis. Therefore, several nursing interventions are aimed at preventing injury while maintaining and improving skeletal functioning. The nurse teaches the patient range of motion exercises to increase blood flow, improve muscle tone, and maintain joint mobility. The nurse also teaches the patient isometric exercises because these exercises allow the patient to contract muscles without bending the joint or moving limbs to help maintain muscle strength and mass. The nurse also teaches the patient proper body mechanics to perform ADLs and to avoid lifting, bending, or carrying heavy objects to prevent patient injury. Patient education is an extremely important nursing intervention to helping the patient manage osteoporosis. The nurse emphasizes to the patient that he or she must maintain an adequate daily intake of calcium and vitamin D, as this is key to slowing the progression of the condition. Relieving pain is also an important nursing function in the care of the patient with osteoporosis. The nurse teaches the patient that while lying down, that knee flexion increases the patient's comfort because it relaxes the back muscles. Due to immobility and medications, the patient with osteoporosis is at risk for developing constipation. The nurse encourages the patient to intake between 2,000 to 3,000 milliliters of fluid, preferably water, unless contraindicated by cardiac health problems. Not only does this amount of fluid help prevent constipation, but it also decreases the risk of renal calculi formation. The nurse should also teach that to prevent constipation due to immobility and medications, that adequate fiber intake should be consumed daily. A total dietary fiber intake should be between 25 to 30 grams of fiber per day. Bisphosphonates are indicated in the treatment of osteoporosis because of their inhibition of osteoclastic activity, which allows bone remodeling and resorption rates to equalize or become closer to equal rates. This causes decreased rates of bone loss and increased bone mass. Bisphosphonates come in a pill or shot, and most people take the pill once a week. For a bisphosphonate pill, the patient should take the pill first thing in the morning before having anything to eat or drink. The patient is instructed to take the pill with an 8-ounce glass of water. After taking the pill, the patient should not eat or drink anything else for 30 minutes to an hour. The patient needs to avoid laying down for 30 minutes after taking the pill. However, If the patient takes the delayed-release bisphosphonate ristronate, the patient should take this pill after breakfast with 4 ounces of water. Vitamin D helps the body absorb calcium and supports the muscles needed to avoid falls. Calcium helps the body build bones and keep them healthy. If the body doesn't get adequate amounts of calcium daily, the calcium is taken from the bones, which causes the bones to become thinner, more brittle, and weaker, leaving them more susceptible to fractures. Vitamin D and calcium taken together are useful in preventing the incidence of fractures and osteoporosis. The patient is instructed to take a calcium supplement, Caltrate or Citracal, with vitamin D either with meals or a beverage high in vitamin C to promote absorption. The patient is also instructed to split the recommended daily dose. Physical therapy is considered an effective non-surgical treatment option for osteoporosis that may help restore movement, function, and bone strength. The physical therapist teaches the patient with osteoporosis exercises for bone health and ways to manage daily activities to lessen the chance of an osteoporosis-related fracture. The physical therapist's plan of care includes bone strengthening exercises such as weight-bearing exercises, and techniques and exercises to improve balance and posture. The most serious complication of osteoporosis is a fracture. Spine and hip fractures may lead to chronic pain, long-term disability, and even death. Another complication includes depression as a result of immobility and pain that may be caused by immobility.